Don't sign that hospital form just yet. If you're over 60 in Australia, the most expensive moment of your hospital visit might not be in the operating theater. It might be when someone slides a clipboard into your hands and asks you to tick a box. In early 2025, older Australians with private health insurance paid nearly $470 out of pocket for each hospital stay on average, and for orthopedic operations, those surprise gaps were often more than $750. Those bills come from unexpected places, and they can ruin your recovery. So, before you go under the knife or sign anything, listen to these 5 traps and the exact questions that could save you money and stress. Hi, I'm Patrick. I'm not a doctor. I'm a consumer advocate who spends his time reading government reports and insurance small print, so you don't have to. Everything you're about to hear comes from official sources like the University of Melbourne, National Seniors Australia, and the Private Health Insurance Ombudsman. Check the description for the links. We'll start with a sneaky trap and count down to the biggest shocker. Trap number 5. Hidden doctor fees and gap payments. Imagine this. You agree to a knee replacement because your surgeon tells you they operate under your insurer's no-gap agreement. You feel relieved until a few weeks later when bills arrive from an anesthetist and a surgical assistant you never met. In Australia, doctors and assistants can charge above the official Medicare schedule. If they don't take part in your fund's no-gap scheme, you pay the difference. That's why the average privately insured patient was hit with a $470 gap early this year, and why many orthopedic patients were charged more than $750. Here's how to protect yourself. Before your procedure, sit down with surgeon and ask, are you and every other doctor involved, the anesthetist, the assistant, covered by my fund's no-gap scheme? If not, how much do they charge? Then ask, can I have a written quote covering all their fees, including operating theater and prosthesis charges? Finally, ask, are there any other out-of-pocket costs I should know about? If they won't answer clearly or supply a written estimate, consider postponing or finding another provider. Under informed financial consent rules, they must disclose these costs. Trap number 4. Private versus public patient status. When you arrive at a public hospital, you may be offered a form that says, would you like to be treated as a private patient? Many people assume going private will get them faster treatment. In reality, elective surgery wait times are based on medical need, not insurance status. Private status means your care is funded by your health insurer and out-of-pocket contributions, not just Medicare. You might get a private room or choose your surgeon. But you can still get bills from each specialist, as well as accommodation and theater fees. As a public patient, the hospital and Medicare cover the costs. Though you may not pick your doctor, you always have the right to stay public. No one can force you into the private lane. So when the admissions clerk hands you that form, pause and ask, am I being admitted as a public or a private patient? What will each option cost me? Then ask, will going private actually make my surgery happen sooner? Are there gap fees for doctors, surgery, or accommodation? If you don't get clear answers, choose public for now. You can always elect private later. Trap number 3. Medication changes and discharge errors. Picture yourself on discharge day. You're tired, you want to go home, and a nurse hands you a list of medications. Most people glance at it and leave. Big mistake. Transitions of care are one of the riskiest times for drug errors. Studies show that medication lists in discharge summaries are often incomplete or wrong. Patients are started on new drugs and stop old ones without a proper explanation. Sometimes the changes aren't sent to their GP. To protect yourself, ask these questions before you walk out the door. Have any of my medications changed? Why? Are the dosages different? Then ask, can I have an up-to-date written list and a full discharge summary? And finally, has this summary been sent to my GP and uploaded to my MyHealth record? Once you're home, sit down with your pharmacist or GP. Go through every medication. Make sure you know what to continue, what to stop, and why. If something doesn't add up, call the hospital and ask for clarification. Trap number 2. Liability clauses and hidden costs in admission forms. Many hospital admission documents include a clause that says something like, "I agree to pay all hospital accounts, including those not covered by my insurer or Medicare." That one line can make you responsible for every charge the insurer declines, including allied health services or transport costs. Most people sign without reading. Informed financial consent rules say your doctors must give you a written estimate and explain any gaps before treatment. So before you sign, ask the admissions officer. This clause says I'm liable for all costs. What exactly could I be charged for beyond my insurance? Then ask, will you remove or amend this clause so I only pay what my health fund refuses once I see an itemized bill? And, can I have a written, itemized estimate of all charges, including doctors, hospital, prostheses, and any extras? If they won't adjust the clause, you can write in your own words, "I accept financial responsibility only for amounts not covered by my insurer after receiving an itemized statement." This doesn't guarantee immunity, but it creates a record that you contested the clause. For complex situations, call your insurer or seek independent advice before signing. Trap number 1. Ambulance fees and transport charges. Here's the shocker. In most of Australia, ambulances are not covered by Medicare. A single ambulance ride can cost anywhere from around $400 to nearly $2,000, and helicopters can cost tens of thousands. Some states include ambulance cover in their electricity bills or taxes, but others don't. Many people only discover this when they get a bill in the mail. Protect yourself by asking these questions now, before an emergency. Do I have ambulance cover through my private health insurance or through a separate subscription? Does it cover both road and air ambulances? If the answer is no, sign up for your state's ambulance membership or ensure your health fund includes it. If you need a non-urgent transfer between facilities, ask whether your insurer or the hospital will arrange and pay for transport. And if you ever have to call 000, remember that saving a life comes first. But at least you'll know the potential cost. Let's recap the 5 traps and the questions to remember. 1. Hidden doctor fees. Ask if every specialist is in your insurer's no-gap scheme and demand a written quote. 2. Private versus public status. Ask about benefits and costs. Don't assume private means faster. 3. Medication changes. Get a current list and discharge summary, and confirm it's been sent to your GP. 4. Liability clauses. Read the fine print and insist on a written, itemized estimate. 5. Ambulance fees. Know your state's coverage and get a subscription if needed. Take a screenshot or write these questions down so you have them ready. If this video helped you, please tap like and share it with a friend or family member who might be heading to hospital. Your support helps us keep making practical guides like this. For more tips on avoiding hidden costs in aged care and rehab facilities, subscribe and turn on notifications because our next episode dives into traps at nursing homes and rehab centers. Let us know in the comments if you've ever been hit with an unexpected hospital bill or if you have advice to add. Stay safe, stay informed, and thank you for watching.